How is shunt stenosis treated after a portosystemic procedure? When a portosystemic shunt starts to narrow or block after surgery, doctors focus on restoring blood flow to keep the liver healthy. The most common approach is an endovascular procedure, which means working inside the blood vessels without open surgery. The main treatment is percutaneous transluminal angioplasty, where a small balloon is inserted into the narrowed part of the shunt and gently inflated to widen it. This helps improve blood flow and reduces pressure buildup. Often, doctors will place a tiny metal mesh tube called a stent inside the shunt after balloon dilation. The stent acts like a scaffold, holding the vessel open and preventing it from narrowing again. If the narrowing comes back, repeat ballooning or additional stents can be added to keep the shunt open longer. In some cases, if the shunt becomes completely blocked or develops a blood clot, procedures like clot removal or thrombolysis may be needed before angioplasty. Regular imaging tests such as Doppler ultrasound, CORT scans, or direct portography are essential for early detection of stenosis. Catching narrowing early allows for prompt treatment, which helps prevent complications like increased portal hypertension or worsening liver function. If endovascular methods are not successful or are not suitable for the patient, more invasive options like surgical revision or shunt replacement might be considered, but these are less common. It's important to remember that each patient's situation is unique. The overall health of the liver, the severity of the narrowing, and other factors influence the treatment plan. Maintaining shunt patency is vital for controlling portal hypertension, which can affect liver health and the risk of liver cancer. That's why ongoing follow-up and imaging are key parts of managing these patients. In summary, treating shunt stenosis usually involves minimally invasive techniques like balloon angioplasty and stent placement. Surgery is reserved for stubborn cases. Regular checkups and imaging help ensure the shunt stays open, supporting liver health and reducing complications. Always consult a healthcare professional for personalized advice and treatment options.